Okay, thank you, Raja, for inviting me for this session. And I think this is a great session, especially because it talks about the guidelines. Now, I am going to be talking to you about advocacy and guidelines. What is the role of All India Ophthalmological Society? Whatever guidelines they come out through the All India Ophthalmological Society, maybe they don't have any regulatory role, but they do have an advisory role, and the various other organizations do refer to these guidelines in case if there is any controversy or in case there are any legislations, etc. And they do help our members also in that way. So, as the leading professional association, it does play an important role in promoting and advancing the interests of the profession, and they can advocate also for policies and practices that can improve eye health outcomes in the country. AIOS does play a key role in developing and disseminating the clinical guidelines by the ophthalmologists in India. Uh, as far as advocacy is concerned, it does raise the awareness about the eye health issues. It educates the policymakers, the healthcare workers, and the public about the importance of the eye health. It promotes policies and practices that can improve eye health outcomes in India, and also indirectly reduces the burden of preventable blindness. Now, we have been developing and disseminating guidelines. Sometimes they are done in a more planned manner or a structured manner. At times, they are done as the need be, and sometimes they are done out of crisis management. Standardizing the clinical practice is required to ensure high quality, evidence based care. And like I said, regulatory role is not there, but advisory role is definitely there. So, for instance, when the end of thelmitis guidelines did come up, they will not, they will guide the AIOS members on what is the minimum that they should do, and these guidelines are made very loosely. We don't try to be very strict about everything, because we know that once you write a statement there and say that this is mandatory, then somebody can catch you on it that this was not done and this has been written mandatory. So a lot of advisory, and preferably this should be done like this, is the way we put it in the guidelines, except for the things which are really very essential and when which you can't let go. So these are just to give some examples. This year we published guidelines on intracameral drugs in ophthalmology, because lots of intracameral drugs, including moxifloxacin, uh, is an off-label use, and even the manufacturer will not say that this is fit for use intracamerally. But if you come up with these guidelines and our members are using intracameral drugs, and if there is a adverse event, then at least you can justify that these were dealt by and these have been given by a expert group from the All India Ophthalmological Society and have been vetted by them. So we do come up with these guidelines, and very soon I think we are going to come up with the off-label use of off-label drugs and ophthalmology guidelines, which is again going to be helpful for our members. Now, there are some guidelines. For instance, in this, there was this consensus statement regarding pediatric IO examination, then on primary angle closure glaucoma. Some of them are more clinical, like primary angle closure glaucoma or open angle glaucoma, that were done by the AIOS. And I think very important, although this is not a guideline, is the informed consent books that have been done for ophthalmic surgeries to help the members. And they have been translated into various languages, because you're supposed to take consent in the language of the patient knows, and they have been done by several states. And again, like I said, they don't have a regulatory role, but it kind of gives a template. You can customize it according to the way you want it. As far as advocacy is concerned, this is the step that we took. Then that was exemption from registration of ophthalmology scan A and B and UBM under the PCPNDT Act, and this still exists. There have been 2 or 3 hearings in the court for this, but every time this is still there and it has not been dismissed. So this is the stay order by Honorable High Court of Delhi to say that this has been exempted as far as the ophthalmology scan is concerned. Then, as far as recognition of eye clinics as daycare centers is concerned, at the level of Delhi Ophthalmological Society, again, this has been done and the process is continuing. And I'm sure even if a single state gets something on the recognition of eye clinics as daycare centers, then all the other states can use that document to to replicate it in their states, and at least to reproduce it and use that as a precedence, so that it can be done in their states. Then likewise, there was a GST on refractive and LASIK surgery, and again we represented to the Department of Excise that this GST on cosmetic surgery, they were wanting to levy, but as of now it is not there. I don't know whether it is there in all the states or not, but at that time measures were taken so that this was exempted, because refractive surgery is not a purely cosmetic surgery, it has a therapeutic role also. So, rationalization of rates for ophthalmic surgery procedures under the Ayushman Bharat Yojana. I think I would like to recognize the efforts of Dr. Raja Narayan in this. We helped to formulate the guidelines so that the charges could be increased a little bit. Though we did succeed partially, but not completely in this, and I think uh, uh, it is important to have the representation there, and representation of the correct people. Sometimes people who are representing ophthalmology in these kind of committees or meetings actually do not have idea. Like, just to give some example, and this is off the record, that if you have people who are not operating into this committee of Ayushman Bharat Yojana, fixing the rates for the surgeries, then it's not done, because they wouldn't know uh, that they have to fix a lower or a higher rate. Plus, if you take people who are only from the government organizations, then possibly they don't spend a lot of money on other peripherals and other things which other private practitioners, whether solo or group practice or charitable institutes, would be doing it. So we made a document where we took three or four representation, one from the solo practitioner, one from a group practice, one from a charitable trust, and one from government organization, and placed the rates of all those and took an average of what it should be. Of course, it hasn't gone through, because they say that when the rates are going to be revised, they're going to look at it. But this is important, and unfortunately the government of India and the Ministry of Health and Family Welfare, when they make their policies, they don't include the societies, but they include the institutes. And it would generally depend on who's being representing there, and whether he's able to take the call of the ophthalmologists at large or not. Now, in the COVID-19 initiative, we did come with the various guidelines on which were on various specialities. One was OPD management, OT management, then how to deal with the retina cases, the glaucoma cases, the cataract cases, the oculoplasty services. And these were dynamic guidelines, because as the COVID situation changed, they had to be changed again and again. Now, this was a representation which was done to the Honorable Finance Minister at that time in COVID, only because people were not able to pay their EMIs for the instruments that they had purchased. They had given FDCs, they had given PDCs, sorry, and these had to be, honored for a prolonged period of time, because of the COVID situation, as the finances for our members were not up to the mark. So it did work out. At that time, we didn't know what we were doing, but every possible measure that we took actually worked out. And then there was a sample for force majeure letter for the landlords, especially for those practitioners who were practicing and had to pay their rent, and needed a deferment of the rent because the practices were not happening. Then to the industry partners, we appealed, 164 in number, to support with the deferment of payment, extension of AMC and CMC during the period, uh, and to extend the warranty, etc. So our partners also relented. Like I said, somehow whatever we tried in that period actually did work and did give results. It doesn't happen always. Then representing to the telemedicine, for the telemedicine practices guideline, that telemedicine should be allowed, and simultaneously it did happen that through telemedicine also people could see patients. Then representation to the IRDA regarding the clause subject to exclusion of communicable diseases in the professional indemnity policy, that was done in 2020, and this communication was received from IRDA regarding the withdrawal of the clause. Then representation also to the ministry for the same, and these were the operational guidelines of COVID-19, the telemedicine practice guidelines which came, then representation to the Director General to provide immunity to healthcare providers during the pandemic. So to conclude, AIOS, I think why AIOS, any society which is for the medical fraternity, has an important role in advocating for policies and practices that can improve the eye health outcomes in India, and leveraging expertise and influence to promote better eye health outcomes for all Indians is what we are looking at. And this cumulative effort would lead to reducing preventable blindness in the country. Thank you very much for your kind attention.
Yeah, thank you so much, Dr. Namrata. In fact, you've shown how much work you have done also in actually, communicating with the health ministry and various other authorities for the sake of our ophthalmology community. I just had one question when you mentioned about the Ernst and Young costing exercise which was done. I think it was a very important exercise. A lot of insights came from that. Um, what has been the next step in the sense, does it require any further follow up with the government, and how can we improve the overall packages pricing?
So there is a committee, Ayushman Bharat committee. I mean, I don't know the exact name, but a committee which deals with the prices of all this. And when we had made that document way back in 2020, they said that we've just released the rates of Ayushman Bharat, and when they do it after every almost 2 years, if I'm not wrong. And they said when we take it up in the next committee meeting, we'll surely take it up. But I don't know if the meeting is already held. Uh, prop- Possibly, I think there was a document which you had also floated, Raja, that
That was
one has
last year,
to,
so maybe next year they
maybe
might take
next year
up.
they might just take it up. So
Yeah.
somebody needs to follow it up.
Dr. Abha, you have any comments or anything?
It under that, but I can find out because they did look at that costing data and did a cost price differential from the HPP 2.0 before the revisions were made in 2022. And interestingly, and I was really enjoying listening to you, there is also an exercise that we have done looking at current cost accounting practices in India and the willingness of providers, both public and private sector, to share cost data so that better price setting can be done. Because there's always this contention that the prices are not reflective of what the market price should be. So that study should be out maybe in a couple of months, and I'll share that paper as well.
Yeah.
So very nice presentation, ma'am, and I'm so happy that you brought out that point of price fixation, because when you have these national policies, I remember being a part of it when Ayushman Bharat was fixing the rates for retinal surgeries. And this is exactly the problem we were facing at that time, that the majority of the representation in that particular meeting was from government organizations, where they have not really put in any investment in the equipment. And what happens is that unduly brings the pricing to a very low level, which is not acceptable to majority of the private practitioners. So I think this is something we are really going wrong whenever we are having these pricing being fixed. There's not an equal representation of all the category of the clinicians or who are dealing with the public.
Yeah. So what happens? They'll just call somebody from Safdarjung Hospital, or they'll call somebody from RML Hospital, and for them, it's done. And just to give one example, terrorism at the cost of 75 rupees is not done. But somebody would have told them that there's nothing much to it. You just have to remove it. But nobody told them that you have to do a auto conj. Fibrin glue is required. So I think it depends a lot on actually who's representing there. And several times, at least on 3 occasions, we've gone to the Ministry of Health and Family Welfare, told the Secretary Health that please call some representative from the society, because the person you are calling is not representing everybody. But I don't think they do it. I mean, they've never done it. It is always that we've had to represent, and then some partial relief has come, not even complete relief.
I remember they suggesting that there should be absolutely no cost for doing a pan-retinal photocoagulation for diabetic retinopathy. I mean, if you come to such things, then I don't think anybody will entertain any patient in their clinic.
So this costing we had done with ENY, and Dr. Mahipal Sachdev was the president at that time. So we had taken the representative data of all the categories of hospitals that were there.
Yeah, thank you so much, Dr.